Hey Nana, how are you?
Hello, I'm good, Dr. Kular.
Good, good, good.
Yeah.
So, how are you feeling after getting operated? What's your experience in this hospital? Can you briefly explain?
Oh, okay. So from the day of operation, it was a very nice experience. So when I came in, I had all my tests done very quickly to check that everything was fine. Then I got my operation. Then when I got operated, about 2 or 3 hours after the operation, I was able to walk. So the same day I was already going to the bathroom by myself. By the next day, I felt much better. And actually, the second day later, because I'm a lecturer, I already had an online class. So by day 2, I think I was feeling strong enough to have my online classes. And right now, I think way different, better, feeling more energetic.
Very good, very good.
Yeah.
So, you started taking the online class next day?
Yes, I started taking an online class next.
Good, good, good. And you were walking within a couple of hours of the procedure?
Yes, within 2 to 3 hours.
See, here we need to emphasize that in your case, we use the TIVA anesthesia. TIVA is total intravenous anesthesia, where we put you to deep sleep, but it is for very short duration because we can complete this surgery in 18 to 20 minutes. The team is, from last 15 years, we are doing the same dance.
Yes.
So your team becomes synchronized. You don't waste time in between the steps.
Yeah, I see.
And mini gastric bypass is a fast surgery. And so completing in 18 to 20 minutes using TIVA, not paralyzing you. The main catch is,
not paralyzing.
why you are not catheterized? Why could you go to the washroom and pee yourself? Because you were not paralyzed.
Oh.
And going by the old techniques of anesthesia and surgeries, where you take like 1 hour for the surgery, obviously then you have to paralyze the patient. Then you don't have an option. And if we paralyze, then you are in the bed for a long time. And if you are in the bed for a long time, then everything changes. We have to catheterize you.
Yes.
That increases the chances of urinary tract infection. Then we have to keep you in the bed for a long time. That increases the chances of clots coming up in the deep veins of the legs and going up and blocking the chest.
Yes.
The clot thing.
Yes.
Somehow, if we take less time for surgery, don't paralyze the patient, suddenly bariatric surgery starts looking very simple.
I
And
see.
that is how you had this experience.
I was asking myself. Okay.
Yeah, that what is this?
Yes.
Although it's a major procedure,
Correct.
I changed all your connections from inside
Yes.
because that is what is going to change you.
Yeah.
How much you lost in these?
I've lost 7 kilos already.
7 kilos.
In 7
It's
days.
going fast, yeah. Yeah. So you are here not as our patient now, because normally we send the patient home on day 2 or day 3.
Correct.
Because you have to go back to South Africa.
Yeah.
And this is another option which we are giving to our patients who are coming from abroad, that don't go and stay out in the hotels.
Yes.
Because especially in these COVID times, what's your opinion about the cleanliness, the air quality, or the environment in the hospital?
Okay, so my experience, I was actually explaining to my younger brother. I was very impressed because, at any time, every 2 to 3 hours, you have the nurses that would come in. So my blood pressure, my sugar, my cholesterol was constantly checked maybe 4 to 5 times in a day. Place is very clean. I have an air-conditioned room. So you can see I sweat all the time. I'm always hot. So in my room, I'm in peace because I've got air conditions, I've got the fans, and the cleaning ladies are there anytime. So anytime I just buzz and they come. So I was impressed by that.
So you had diabetes, high cholesterol, high blood pressure,
Yes.
and snoring and sleep apnea.
Yes,
So
everything.
you had all the, it was a kind of cocktail of diseases which you were carrying.
Exactly.
So, when you lose weight, then suddenly everything starts becoming better. You have seen your diabetes control becoming better now?
Yes. My blood pressure is normal now.
The main thing is it's like designing.
Yeah.
If I do make it too tight, then you will be retching, nausea, vomiting all the time.
Yes.
So how much nausea and vomiting you had after surgery?
Zero.
Zero.
Zero nausea, zero vomiting.
See, that is again, it was a challenge in bariatric surgery.
Yes.
Because making the pouch small, brings you nausea and vomiting.
Oh.
And putting a tight band on the outlet,
Yes.
it will increase the reflux.
Mm.
So, but you cannot eat big amounts.
Yes, I can't.
So it's a restriction without obstruction.
Oh, yeah, I
So,
like that.
yeah,
Mm.
it's a functional restriction because now whatever you are eating, the opening is wide.
Yes.
We are not stopping you from eating,
Oh, I see.
but you are not eating too much.
Yes.
The reason is now you are not eating into that old bag.
Yeah.
Now you are eating into the delicate intestine.
Oh.
So this is the difference between the present day
Oh.
mini gastric bypass designing and the old restrictive techniques
Oh.
where you feel choked, food is not going down.
Yes.
Then you will select something else.
Mm.
Maybe 2-3 shots, maybe some cold drinks,
Correct.
soda pops.
Correct.
Because they will go down
Go
easily.
down. Oh.
So that is how those patients were pushed towards soft calories.
Oh.
But here, if you can, like, what were you eating now? Semi-solids, dal, dalia, khichdi,
Yes.
some soft
Yes.
vegetables
Yes.
you're already
So
taking.
That's what I'm taking, yes.
See, that is the revolution in bariatric surgery. Earlier, you would have been maybe for 6 weeks, you would have been on liquid diet. If you see the guidelines on the internet, how to eat after bariatric surgery, they
Yes.
tell you that for 6 weeks you
Correct.
have to be
I've
on
seen
liquid
that.
diet.
Yes.
But you are not on liquid diet.
No, I'm not.
You are enjoying your food,
Correct.
no nausea, vomiting,
Correct.
lost how much?
7 kilos.
7
in 7 days.
So this is mini gastric bypass revolution.
Yeah.
We must thank Dr. Robert Rutledge
Yeah, no.
for this. He brought this design,
Yeah.
and I got trained by him.
Yeah.
We have worked like for more than 15 years.
Okay.
Every year he would come here, stay here for 2 months.
Uh-huh.
So anything you want to say? You have a lot many heavy people in your country.
In South Africa, they don't even do the mini gastric bypass yet.
Okay.
They still do the raw wire.
Oh, and why? The
Yeah.
40 cc
The
capacity.
40 cc.
Right.
That's how expensive
Yeah.
it is.
Yeah.
So it's
Okay.
not affordable, and yeah,
So go back and tell them
definitely.
that,
I'm sure they would see from me. I mean, they would see the results.
Okay, now take care.
Thank you, Doctor.